We are back. Hit that share button, everyone. Hit that share button. Tag some friends. The ladies of Say Word. We're back.
Hello.
Hi.
Jackie, I can't hear you, sis.
Hey, everyone. Hit that share button.
You were just looking so cute and
just talking,
like, hey,
mouth moving.
Hey, everybody. Yeah.
Listen, I am so glad that we are back on. I'm about to hit my share button.
Yes, me too.
Hit that share button, everyone. Hit that share button. Tag some friends. Let everybody know we're back. I see you, Nanette. Welcome. Oh, I hear.
Yeah,
that's mine.
Okay. That's me. That's you,
That's
Jackie.
mine. I got too many devices over here.
You got too many devices.
Yes, Virginia's on. Frank is on.
Hi, everybody.
Hi, hit that share button for us. Let's get people in the room. This is part 2. Hi, Selena.
Hi, sis.
Hit that share button, everyone.
I'm sharing. I'm sharing too.
Hit that share button. I'm sharing. Share that broadcast, everyone. Hit that share button. YouTube family, what's good? We're back.
Yes. Good. Yes, we are back. I don't know who's here with me, but waiting to see who says what.
Listen, Frank says sharing is caring in my Terrence voice.
Oh goodness. Yeah, isn't that a T Sams thing?
That's a T Sams thing.
Okay.
Fort Lee, Virginia. Welcome. That's where Selena's from. Yes.
Where's everybody?
Hit that share button, everyone. Hit that share button. Tag some folks. Tag some people that you want to be on this broadcast to watch. Tag them. Let them know you're here. I'm about to tag everybody.
You're about to tag everybody.
Oh, I'm
tagging it.
I can't get over
tag
this.
50 people.
Tag 50. Where's my 50?
You gonna tag 50?
I can't get over how me and Candice look exactly the same today, and we did not talk about.
You guys, listen.
I don't.
But you know what's funny? For the same reason. Like I did not have time to do this hair.
I did not have time to finish my hair. That is correct.
I didn't even start mine, though. I didn't even start. I was supposed to do something to my head, and it never happened. So, oh well.
All right. But you guys are looking cute.
Beautiful wrap.
I love these knots. I love these. These are perfect. I have like 5 of them in different colors. I love them.
Yeah, I went to do it, and I'm like, I haven't done it in so long. I almost forgot how to. Yours is like super neat.
Okay, I just posted and tagged.
Wait, you made the knot?
No, I bought this. I got this off of Etsy.
Yeah.
Oh, you bought it with the knot, girl? No. Yeah, that's why yours is so neat.
Yeah, mine comes. I just gotta put it on.
No, mine's was just
and it's lined with satin.
No, I had to make it. I had to do it myself.
No.
I was like, "Ooh, your skills are tight, sis."
And it's lined with satin. Be good. Be good to go.
Lined with satin. Ooh. Yeah, I gotta get me one of those. You gotta share with me where you get yours from.
I'm gonna have to get one too. I haven't gotten down with my wraps, so I need to get on it.
Yeah, you gotta get down with the wrap.
I gotta get down with the wraps. Listen, y'all are looking like twins. The glasses.
No. I said to her before we started, I said, "Are you gonna wear your glasses?" She said, "Yeah, these ones." And I said, "Oh goodness," I just cracked up.
Oh my goodness, laughter is good. Laughter is
Yes.
good for the soul. We need a little
Good for the
laughter.
soul,
Yeah.
especially
Frank said it's a New York thing.
It's a New York thing. Yes.
Hi,
Yes.
Lucille. She is on here with me. She
Hi,
says
Hi,
hi.
Lucille. We've missed you.
Lucille.
And we are so excited to be doing part 2. Get your
Yes.
questions ready for the doctors.
Yeah,
We have Dr.
absolutely.
Yola and Dr. Julius that will be back on with us. And, we just want to talk about these topics. And the big topic right now is the vaccines. Of course,
Yes.
Dr. Yola, she gives her weekly report. Please go to her Facebook page, her YouTube page, her website. I asked Yola, Dr. Yola, and so I'm gonna put that up right here so you guys can see it. Once again, we have Dr. Julius on, who gave such a riveting interview last time. Him and
Yes.
Nikki, it was amazing.
That was great.
Yes, and so we want to see how he's doing now. Nanette says, I love the raps. You both look
Aw.
great.
Thank you, Nan.
She said, I need to learn how to do that. Me too.
I'll teach you, sis. I'll teach you.
Gwen says, hi, ladies. Hi, Gwen. I know
Hi,
Helen. I need to tag Helen in these comments because Helen said that she wanted to be on because she's about to get the vaccine.
Oh,
Yep.
love it, love it, love it.
I'm going to tag some more people. Everybody hit that share button. If you haven't shared already, hit that share button. Tag some folks. Let's get them on the line. Hi, Kelly. Kelly's saying hello.
Kelly.
Yes, everybody's coming on. They're coming on. They're coming on. Okay, so Dr. Yola is with a patient. So she's coming in. Oh, I see her in the green room. I'm so excited. All right, so family, there's been so many people giving us feedback about the last show and how exciting it was, and they love the testimonies. They love how informed Dr. Yola was. They had questions. Hi, Makwa. We have people from all over coming on board. Get your questions ready for the doctor. So we want to get everybody in the room. I'm so excited.
So are we going to start off with this, like Jackie, were we going to talk about
some of our topics? Yeah, so in true say word fashion, I want to talk about something that I learned the other day, that Jamaica was one of the first countries, Caribbean countries, to administer the shot. So here it goes. It says, Jamaica becomes the first country in the Caribbean to receive the COVID-19 vaccines through the COVAX facility. So that's pretty interesting. Never knew that. But what I also didn't realize is that Jamaica had a problem with the community stealing vaccines. 10 doses of the COVID vaccine went missing from Cornell Regional Hospital.
Wow.
So it's gotten to that point now.
It's happening here too.
Really?
I heard a nurse that worked at, I think, Kaiser or something like that, or did the same thing, and she no longer has a license. I haven't heard of anything else, and I pray we don't hear of anything else, but I'm sure it's probably going to happen.
Right.
But
it's been a lot of controversy around that.
A lot of
And I like we were even talking about just the and I'm sure we'll get into that as well later, but now that people are getting the vaccine, Nikki, I know you were mentioning, and you brought up a good point about that, with the cards, like what they actually give you, to say that you received it, and you were like kind of talking about how people doing that, taking it and making photocopies and things like that.
I think they need to come up with something that's going to be more difficult for people to make their own copy, right?
Right.
They need to have a database that says if you've been vaccinated, or just like how we have to get a passport, or now those new passport cards. I think they're going to need to do something a little bit more strategic. Because I know eventually they're going to need to use it to travel. They're going to probably use it to allow you into restaurants anywhere. They can do whatever they want. But what is actually going to make it legit across the board versus some people getting and making those cards? I mean, I haven't heard that or see that, but I think anything's possible. But I think something needs to be made universal, and it needs to be quick.
Right. Absolutely.
I'm sorry. I'm trying to adjust. I'm trying to produce. I see Dr. Yola in the room, and I wanted to get us on a screen, but we have everybody in the house. We have Dr. Yola and Dr. Julius. So I want to bring them on the conversation. I see Dr. Julius. He's getting prepared. Like, this is real time. I saw Dr. I saw. Okay. All right. Here we go. I'm sorry. I'm working with so many screens, family. Hit that share button. Hit that share button while we bring everybody on.
So that's going to be something I'm really curious about, because I know that they have like a database that, for people with opioids, so that they're not, sharing prescriptions and things like that. But I'm really curious to see what's going to happen with the vaccine.
Yes,
Hi,
and
Dr.
listen, I had to bring everybody on really quick because I saw, Dr. Yola, welcome back. Dr. Julius, welcome. It's good to have you on.
How are you?
Hi, ladies.
Yes, I'm so excited. But I saw Dr. Yola shaking her head in the green room like, yes, about these cards. So so I had to just bring you into the conversation. She's like, yep. And so we want to talk about everything. Guys, hit that share button. Type in your questions. Dr. Yola was on giving us so much information. Dr. Julius was giving us a riveting testimony about how he beat COVID. Beat it up. Knocked it out.
Well, so we were kind of like having this conversation, Dr. Yola, the other day, the ladies and I, and we were just discussing, like, with spring break and, the weather changing, that there's, obviously, like, been an increase in the amount of people on the outside, so to speak. People are just tired. They want to go out. So we were just talking about just this idea of, first of all, the age where people are allowed to get it at this point, and we were talking about at what point are they going to then move it towards the the younger generation. But I mean, we're seeing so many college kids, and this is spring break time, and they're out there, and they are seriously maskless. They're just they're just having a good time,
just wilding out
in Florida.
There you go, wilding out.
They are wilding out.
Their best unmasked life in Florida. No, absolutely. I think when we think about sort of how do we maneuver through, I continue to use the analogy. I used one of two analogies. Whether you are a Tom Brady fan or not, what I always say is we are in the fourth quarter with 5 minutes left, and we're 2 touchdowns up. When you play against Tom Brady, you cannot sleep on his skills, right? No matter what, if you like him or not, you can't sleep on his skills. The sneak attack is real, and he will end up winning Super Bowls. The same thing, like if you're in a scary movie. This is the time when you're in the house, and everybody's like, stay in the house, and you're like, no, I gotta go outside. And then she is usually the case, right? In the movies, it's always the woman, usually the white woman, who runs out, and then Jason is right around the corner when you thought you had knocked him out. That's what COVID is. COVID is Tom Brady. COVID is Jason with an axe. What we cannot do,
I love that analogy. Get it,
is either sleep on the vaccine, right? So initially, the rollout from December, January through now has been focused on our frontline workers and our seniors, right? And rightfully so. But we are at a point now, especially with AstraZeneca getting ready to apply for their emergency utilization authorization, we are at a point now in terms of vaccine supply President Biden reached his goal, 42 days ahead of his anticipated benchmark. We're at that place where we have to get our young people vaccinated. We know that compared to our seniors, our young folks aren't going to necessarily wear their mask. They're not going to socially distance, and for a variety of reasons, because of development. Just developmentally, they are wanting to be social too. They do not see their lives at risk in the same way that us, what I consider myself a little bit of an old head. I'll be 50 in 2 years. So what I'm not going to do is be out in South Beach maskless and living my best maskless life. I like to live till 100. So what I'm going to do, even in the face of having received the vaccine, is still wear my mask. So for all of those reasons, I really think we need to focus on our younger folks. We know that all of these vaccines are approved in some capacity between the age of 16 plus, right? When you think about Pfizer, their youngest patients were 16 years old. We can't wait until all of our seniors decide to get the vaccine. I think we have been in a space long enough for most seniors to be able to access it. I think we should still prioritize our seniors, our frontline workers, and those with chronic diseases, but we definitely need to open it up to everyone.
Wow.
Yes.
Yeah.
And I mean, and have you noticed, or Dr. Julius, have you guys noticed, or even Dr. Nikki, a rise in the number of people now wanting to get the vaccine? Because I was having this conversation as well with Jack and Dr. Nikki, and just thinking back to when we met last month, and just even at that point, me kind of contemplating what I wanted to do about the vaccine, and then here it is, the weather breaks, you want to take vacations, you want to be out and about, and, things are opening up more so than they were, obviously, this time last year. We were on that complete lockdown. So I wonder how many people feel like now they're ready, or that's kind of what's been the push for them to go and do it. Not necessarily like worrying about their health in that way, more so feeling like I want to be out and about. So I was telling the girls, there was this funny TikTok with a young lady, and it said me getting the vaccine or why I'm getting the vaccine, and then it showed her, she's out at the beach partying, she's at a bar, and she's like, this is what I need to do this summer, so I'm going to go out there and get the vaccine.
Right. Yeah. No, absolutely. So, I definitely see more people wanting. We were in the same position, right? The last time we connected, yes. I was still in contemplation. Since then, I've rolled up my sleeve and gotten the first of my Moderna shots. And wow. For me, it was really reaching a certain threshold, a number of people who got it to give me the piece that I needed in terms of efficacy and side effect profile.
So can you tell us about that? So that is really key. Everyone who's watching and viewing, I know we had Helen, who was a viewer, that said she wanted to listen to the show tonight because she's taking the vaccine next week. And I know people are going to have questions, but can you take us through that process, being that you just got it? How were you? How did you feel? And all that.
Good. So the reason why I was ready to roll my sleeve up at that point was we had reached 10% of the population having received both doses of either the Pfizer or Moderna vaccine. In any scientific study, whether it's qualitative or quantitative, a 10% sample size is very representative of your general population. We reached that benchmark on the 1-year anniversary of COVID-19 being classified as a pandemic. So clearly the stars had aligned. I went to the site. Right. I had made sure prior to getting my vaccine that I was hydrated. I was well rested. I had focused on incorporating some antioxidants in my diet because I knew not only would my immune system be on 100, but there's also some inflammation associated with just the way the body works. I got my shot. Shout out to MedStar Southern Maryland, my nurse Vanessa, who hooked a sister up. It didn't even hurt. And I'm needle phobic. Like, all the nurses pull straws to see who has to give me my flu shot every year. And the fact that it was like I videotaped myself and posted it on social media, I didn't wince. Now, was my arm a little sore afterwards? Absolutely. But was I literally swinging on a vine out at Jug Bay the next day? Yes, I was. I was teaching my little one how to climb a rope in the park. Wow. In a couple of days, my arm was a little bit sore, but I purposely put it in my right arm because that's the arm I use most. And the more you move muscle, right, the more blood flow comes, the more it dissipates through your system. You don't want to lay around. You don't want to sort of be in I got a shot, let me just chill out. No, you want to hydrate, You want to exercise if you feel up to it. You really want to make sure that you're putting in your body anti-inflammatory foods, but you also want to avoid the foods that are going to trigger inflammation, like lots of sugar and processed foods.
That's a really good. That's really good for us going into the next phases, because there are going to be a lot of more people on board. They're watching. Everybody's watching the other person. And so, guys, write this down. Anti-inflammatory foods. You want to be able to take those things in your body and get yourself prepared for the vaccine, if you're going to take it.
And I'm glad to know that there are a lot of people who were saying no, that I know personally, who are actually looking to take the vaccine now that they have been educated much more and see that people are actually okay and they're better off getting the vaccine than not. There's still a lot of people who are still on the fence, and I pray that this show and other information that they receive will allow them to make that decision to hopefully get vaccinated. But I do believe that it's moving in the direction that you need to be vaccinated for a lot of reasons, or things to do, whether travel, eating out, doing anything. I think that's what's going to happen now. So just like your driver's license, to get certain things, you're going to need some sort of information to show that you have been vaccinated. So unfortunately, I know a lot of people they don't want to feel forced to do it, but I think that's the way that everything is moving. So hopefully people get vaccinated sooner than later. That's just how I feel.
Well, I haven't taken the vaccine yet, and Candice has not taken the vaccine yet. And so this is a good... we're still... And I'm about to bring Dr. Julius back on. Dr. Julius, after catching, going through this whole process and fighting and beating COVID, I know in the interview, I don't know if we actually played it, but we talked about, were you thinking about getting the vaccine? What's your feeling now?
So I felt the same way everybody else did about being hesitant, being apprehensive, and wanting to take my time. But my reasons were a little bit, in the back of my mind, I still had all those past horror stories about what happened to our people with Tuskegee and whatnot. But specifically for me, getting COVID and the time frame and the amount that I went through was enough scare for me not to want to introduce it to my immune system right away. So when it happened and people were asking me over and over again if I had intended on getting it, I said, not right now. I want to let my immune system recover and give them to feel confident, because the physical, the mental, and are all connected. And if we're not on the same page, one of those segments in my armor would be the kink that knocks me out. So just to be sure, just like when I got my first shot, I got the Pfizer shot back a couple weeks ago.
Oh, so you did get it?
My second shot is due on the 1st of April.
Oh, wow.
I got it.
Okay.
I got it. So
all right.
Yes,
so you got it. Because going through.
Yeah, exactly.
I love it.
Exactly. So for me, my motivation was I wanted the opportunity to hug my father again doing it. So I made sure I went ahead and registered, got it taken care of. One down, one.
We're having a little bit of stickiness with your reception, and I want to make sure that everybody gets to hear your testimony, because you had a tremendous recovery story, and the fact that you did take it after getting it, it's like
it's bananas.
Okay. Well, and I want to know, did you feel anything after the shot? How was your feeling? Like, did you feel okay?
Yeah.
Did you get yourself prepared, like Dr. Yola said, too?
Yes. So remember in that first interview, I was saying about the natural homeopathic thing and consuming in preparation. All that stuff that I was doing all of 2020 prior to me getting sick, I went right back to those original remedies. So getting my little 5 ingredients and drinking that for a week. Just drinking it. And I made sure that I did that just to prepare my immune system to protect me. And for my next shot, that's the intent again. When I got my shot, it was so quick. You know, they made you sit and wait for 15 minutes to make sure that you felt okay. But it just felt like a flu shot. Little soreness in the left shoulder. Even now, I don't feel anything. It was a few days after that I was checking. I was like, no temperature, no coughing, no wheezing, none of that stuff. From what I understand is that the second shot is one that really pushes you a little bit in terms of your response.
Yeah,
so
I see.
I'm looking forward to drinking a whole lot of my tonic.
Well, Dr. Yola, thank you for
affected on the second shot.
Yeah, the second shot. Now, thank you for
affected.
Right. Thank you for reminding us about being hydrated, because you said you had to make sure you drink a lot, because most of us are not thinking about these things. We're more worried about taking the test or taking the vaccine than getting prepared to take the vaccine. Right. And so that is very key. I want to talk about some comments. Frank says, I don't know, Candice, did you see the comments? Frank says, does everyone really need the vaccine? He says, does everyone really need the vaccine? I believe in exercise and pumping the body with vitamins, just saying.
Well, certainly it's an and, not an either or, right? So when we think about who has died of the 530,000+ people who have lost their lives to COVID, if we just focus on that, I can guarantee you that a decent percentage of those individuals were pumping their vitamins, exercising, and living their best healthy life. I know people personally who died of COVID who were probably eating better and cleaner than I did. So it truly is a roll of the dice. You don't know who is going to be the one ends up in the hospital, who's going to be the one, even with mild COVID-19 symptoms. We just learned that the CEO of Texas Roadhouse committed suicide because part of the rationale being persistent COVID-19 symptoms. One specifically was tinnitus, which is a persistent ringing of the ears. This man was suffering so much from that and whatever else was going on with him that it facilitated him deciding to end his life. And certainly that's the extreme example. But I know of patients, even now, who are personal trainers, who are just bananas athletes who acquired COVID-19, and it has impacted their capacity to make a living because their lung capacity isn't where it was. They cannot reach their same level of fitness. So those are the things that we have to keep in mind. It's not just you being hospitalized, because we know of all the people who get COVID-19, only 16% of people are going to end up being sick enough to be hospitalized. Only 4% are going to be sick enough to need ICU care. It's the other 80-something% that are going to have mild symptoms, but then those mild symptoms will be persistent. Brain fog, decreased lung capacity, tinnitus of the ears, all of those things will impact your health. And you can certainly take, I'm as probably one of the most granola doctors you're going to meet. I got a whole box of essential oils sitting right next to me. This is my box of essential oils, right? I got all the vitamins. I got the herbs, the spices, the whole nine. But what I'm not going to do is play Russian roulette with my health. I'm going to roll my sleeve up and take my vitamins all at the same time.
I love it. That's good.
That's it.
Good.
And what do you have to say about about the idea of once you do get the vaccine, that there's a lot of people who feel that they can now just go maskless, they don't really have to follow the same protocols and procedures. Do you hear that a lot? Or exactly.
Dr. Nikki, I'll let you answer that one. I can jump in.
I think a lot of people do feel that way, and it's absolutely incorrect. I think people still need to wear their mask, wash their hands 6 feet away. And yes, there are some new CDC guidelines that just came out that says that if you have been vaccinated and you have people around you in the home, you can go maskless. I love it, but I still will be cautious about it. I'm happy to know that a lot of my immediate friends and family have gotten vaccinated, which makes my wedding look even more beautiful. to worry about. But I am so happy to see that. And it's not that I had to call people like, hey, you're getting vaccinated. No, we're all on the same page. And there's nothing wrong if you still are not wanting to get vaccinated. I get it. I respect that. But I really am still going to be wearing my mask. I think everybody needs to continue to wear their mask until we get more research on this COVID-19 and also with what actually happens after you get the vaccine. So yes, everybody should still be wearing their mask. And if if I see somebody, I'm going to ask them like, hey, can you please put on your mask? Or, I mean, you pick and choose your battles, if you understand what I'm saying. But
right.
I think there's a lot of people who still do not know, because I actually went to a new hairdresser and a lot of people still didn't know the facts that was in the hairdresser. And it's still a point that you need to educate folks, but it's also if they're willing to listen.
Right.
You know, some people are just stuck in their ways and also believe what they believe, and that's it. So, yeah.
Now, Dr. Julius.
But yeah.
I think part of the challenge. Go ahead.
No, go ahead, Dr. Yola. Go ahead.
I was going to say part of the challenge is sort of the mixed messages, right? So the CDC says don't wear a mask, and then they say use your T-shirt as a mask, and then they say double mask, and now they're like if you get a vaccine you don't need a mask. We have to really think about what was the purpose of this vaccine. What research questions did they ask? It was, does this vaccine decrease symptom severity, and does it prevent death? The question was not asked, does it decrease risk of asymptomatic infection and transmission? That question is just now being addressed. There was just a study out of just released last week. We're looking at 44,000 individuals who had to have a COVID screening and test prior to a hospital procedure. They were screened on about COVID-19. There was 80% less likelihood of those who had received the vaccine after having been exposed to COVID then becoming positive. So they have now speculated that in this study there was an 80% less of developing COVID after being exposed if you've gotten the vaccine. That still leaves, even if this evidence is true, that still leaves 20% of people who've been vaccinated that can still become COVID-19 positive after being exposed to the virus and then being able to transmit it. For that reason, we still have to be mindful of wearing our mask, especially given the fact the CDC, one of their new recommendations, which I do not agree with at all, is that if you have the vaccine and you've been exposed, you neither need to quarantine nor be tested. I call BS. What you still need to do is at minimum get tested so that you know what your risk is to others, right? Because we know that there's a population of people who are not going to get the vaccine and a population of people who cannot get the vaccine. And for those reasons, we should still mask up. And if we're exposed, we should still test ourselves.
Wow.
So I have a question here from Tia. She says, I'm a school leader. Yesterday, I revised their guidelines to allow secondary schools to allow desks in classes to be 3 feet apart. Any data that proves why the space is shortened? Good question.
Wow. Excellent question. So the CDC looked at school openings across the globe and across the country to determine with closer proximity were there risks of COVID-19 transmission. And there were not. So this was specifically in the school setting, not in the general public. We know that the COVID-19 virus can travel in respiratory droplets as minimally as 3 feet or as distally as 22 feet with an average travel space 6 feet wide. That's why this whole 6 feet of social distancing came about. But specifically in the school setting, when they looked at the data to determine how closely can children sit together with there being minimal risk of exposure to COVID in the face of mask wearing, right? It's not that kids are sitting close together and their masks are off. But if you can keep little ones with their masks on, you can sit them as closely as 3 feet where they will still maintain good protection.
Okay.
Excellent.
That's excellent.
I love it.
It's excellent to know because I'm in the process of deciding. Well, I decided that the kids would stay home until the end of the school year. So it's not decided. I decided that they're going to stay home, but we're going into next year and what that would look like, you know?
Right.
Yeah.
Dr. Julius, were you having any adverse? You didn't have any reactions to the vaccine, But were you having any symptoms from before, from your recovery?
Yes. So I got COVID back in November. I was released from the hospital the day before Thanksgiving. And I actually didn't return to work until 30 days after that. It wasn't until MLK Day that I was able to do a full out bike ride with my twins to go to a service project that was about 2 miles away. And what I noticed during that time frame, now MLK Day was the middle of January. I got sick in November. So that's 2 months. 2 months, right? And it wasn't until that day that I realized that I wasn't huffing and puffing. I no longer experienced that pressure in my chest because I grew up as an asthmatic, so I know how that feels. And I didn't have the taste of blood in my throat when breathing hard. Up until that point, that was the case for me. So going up and down my own steps, standing up to cook, clean, or do any type of household chores or anything like that, and even just trying to walk with my kids, just to go to the park that's a few feet away from our house, it took a lot of effort. So little by little, I kept pushing myself more and more to make sure that I'm not getting complacent, I'm not resting too much, I'm not being lazy, but at the same time, I wanted to make sure that I was pushing myself physically, mentally, and emotionally. So I started doing my research and started doing as much as I could to find out how to recover faster. As a physical therapist, our job is to rehabilitate people. Well, just like Dr. Yola was talking about, personal trainers not be operate and be there at their best, I couldn't take that risk. So I had to show myself, I had to show my family, I had to show my patients that I'm in this fight with you. I am trying to recover. I'm not taking this thing laying down. I made sure that I rested as much as I could. At the same time, taking my sea moss and taking my other beverages and all that to make sure that I was fighting. But this little gadget right here, this is what pushed me on the inside. This is what I had to use to make sure that my lungs were recovering. Wow. Doing the cardio and walking for 10 minutes or trying to play soccer or basketball with my kids or bike riding, that's one thing. But I had to get to that point, and this is what helped me to do it. And the of doing this requires a lot of effort to get that thing moving and push that air out as much as you can to make sure your lungs are expanding and applying the pressure to it. It takes a lot of fortitude, mental fortitude to fight past that pain. Like not being able to expand your lungs as much as you can and breathe as much as you want, it hurts. And pushing that envelope hurts. So getting past that pain was definitely, and it was a full 2 months before I could say, all right, now I feel safe enough to push the limits even further. And that bike ride was a true test. And if anyone goes to my social media, my IG page and my Facebook page, you'll see that I said on this day, today, this is when I didn't feel those symptoms that I had just mentioned.
Wow.
And so I just noticed
in March, I felt safe enough. Say that again?
I just noticed you ran up the stairs.
Running up the stairs, right?
Oh, right. When you in the camera.
Exactly.
Yeah,
exactly. And I didn't even think of it. It wasn't even like a second nature thing. It was just like let me get to my destination. I didn't have to prepare to run up the stairs. That wasn't the case 2 months ago. You see what I'm saying? So, now I've gotten it, March. It was almost 90 days that I waited. Actually, no, almost 120 days. But it was the middle of March that I actually got the first vaccination.
Okay.
And people have to understand, you got to wait 90 days after you have had COVID.
First.
Right.
Well, you don't have to wait 90 days. You don't have to wait 90 days. The key, though, is that 90-day marker lets us know when your antibodies, your circulating antibodies, start to significantly decline. So you can get the vaccine earlier than that, but understand that After 90 days, you run the risk, especially with variants circulating, you do run the risk of starting to increase the risk of being reinfected. And so you don't necessarily have to wait those 90 days, but to Dr. Julius's point, because your system's already primed, ready to rock and roll because you just recovered from COVID, you want to be mindful of how strong with that first dose, if you get Moderna or Pfizer, how strong that first dose may be, but it's not necessarily guaranteed that it might knock you back on your behind. But what's important is what he mentioned, and what we're all talking about is, what do you do to allow the body to recover, restore, and heal? If you come out of COVID and within that 90-day period, you're eating fast food, drinking sugary drinks, not sleeping, stressing all the way out. All of those things are going to facilitate a much stronger impact on your system when it's time for you to get that first or second dose of the vaccine. So you want to go into this, whether you've had COVID or not, as healthy as you can. And if I had had COVID prior to going into getting this vaccine, I would have been even more purposeful in terms of how I approached my recovery, because your system is already set to be on 100. You're going to take it to 150 if you don't do the right things.
Right. I'm glad you clarified that, because I actually volunteered last week at a vaccination clinic, and that is actually one of the questions that they asked people who came in to get their vaccine. And if they did have COVID within 90 days, they did not give them the vaccination. So I'm glad you clarified that, because that's what I've been told and that's what we've been saying. So I'm glad you clarified that.
Yeah.
I do have another question from Tia. She said, with school not being in session for a year, how could that be determined? It's still 6 feet for elementary, but 3 feet for secondary. With 3 feet, students will find reasons to kiss for sure. I gotta laugh at that one.
Right. I love it. No, she's right. Kids are going to be kids, right? Like, they're going to go maskless. They're going to sneeze in each other's faces. It's going to be awesome. What we have to understand is two things. One, I always tell parents, because I'm a pediatrician, and I'm sending my little one back to school, I was like, we can't operate in fear, right? So there are a couple of things that we have to take into consideration when it comes to considering sending our kids back to school. Number one, we look at the data. In Europe, in Asia, and even here in the US, there are schools in California, all along the eastern seaboard. Those children have been in school since last August. We have not yet seen an outbreak of COVID-19 at any school at any time since any of our children have returned back to school. That's number one. That's the most important thing to understand, is no hotspot, no super spreader has started school. What is important is what we as adults do. The more COVID is in a community, the higher the likelihood is that children are going to bring COVID into their classroom. But children aren't bringing COVID from the classroom into their communities. That's number one that we have to pay attention to. The second thing that we have to pay attention to is the balance between the psychosocial impact of keeping children out of school and the educational gap that is further created, particularly in communities of color, especially when we take into consideration the digital divide, right? Where I'm from, in Independence, Louisiana, I have to go to an internet cafe to be able to access the internet. And trust me, I know, because I've had to submit NIH grants, trying to stand on my head, getting some internet service when I've gone back home. So you have to take all of those things into consideration when you balance that with the small but real risk of little ones being exposed to COVID-19 if and when they go back to school. There are a good number of children whose parents aren't capable of serving as their surrogate teachers. There are a good number of children who need to be in that school setting for a variety of reasons: mental health issues, psychosocial reasons, and developmental issues. So all of those things we have to take into consideration. But the most important is understanding that not a single COVID-19 outbreak has been demonstrated across the globe that's been directly linked to a school environment.
Wow, that's good to know. I didn't know that because we've been hearing that schools have shut down or classes or whatever, but we didn't know that it wasn't related to school. It was related to outside issues.
Right. It'll be one case, right? They'll have one case of COVID. They'll shut the school down temporarily to make sure that there isn't like some rampant spread. But because schools have been able to respond so readily, they've been ready to rock and roll. And I think the other thing that we also have to take into consideration are resources. If you go to school in Bethesda, going back to school may be a completely different experience than going back to school in Ward 8 in Washington, D.C. in order for our children to have an equitable return to school in a safe manner, we have to pay attention to the fact that schools need to have equal and equitable access to soap, paper towel, good ventilation systems. All of those things, all of our students should be able to access before we bring them all back to school.
Thank you for that. Yeah, that's good to know, because we had to make a decision, and so we decided, because we only have a couple of more months left, let them stay home. But next year,
right, it
of
makes
course.
Sense. Right. And can you talk a little bit also about the different types of vaccinations? I know that what we were talking about, the most recent with Johnson & Johnson introducing the vaccine, which is like a one dose vaccine. And I know that the conversation that we were having was that 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 vaccine may or may not be as potent as the vaccines that, like the Moderna, and the Pfizer, that are
right.
allowing for the 2 shots.
Right. So with both the Moderna and the Pfizer vaccines, those are mRNA technology-based vaccines that we talked about last time. What those are, a 2-part series, right? One shot at your first dose, and then a second dose between 21 to 28 days later. With that technology, what it ends up being is the body is introduced to what I call the recipe for the spike protein, and just one ingredient for COVID-19. So it's not like the whole virus is introduced into the body, just the ingredients that you need to create the spike protein. So our cells generate a little bit of spike protein over a 3 to 4 day period. The mRNA that has been sent into the cells gets destroyed over 3 to 4 days, does not enter into your DNA, because your DNA is protected by the nucleus inside the cell, right? So that's how that technology is designed. Those vaccines are between 93 and 96% effective against severe disease and dying from COVID, compared to the Johnson & Johnson vaccine, which is a DNA-derived vaccine. So instead of the body having to read the recipe and create the spike protein, what our bodies are exposed to is the DNA in the creation of the spike protein. So the body responds to the DNA components of the spike protein to create the immune response. That's likely one of the reasons why the Johnson & Johnson vaccine is a one dose, because it's that old school way of creating a vaccine. All of our vaccines previously have been based on this DNA technology. It's what's called an inactive component of the virus. In the same way that we do the flu vaccine, the inactivated flu vaccine, the one you get in the shot, not the one you spray up your nose, and all the other ones, hepatitis B, hepatitis A, etc. That's a single dose. Now with that vaccine, the efficacy here in the United States was 72%. That vaccine was tested in South Africa, here in the US, and in Latin America. The challenge was, in each of those segments of the globe, the vaccine efficacy varied a little bit. Highest here in the United States at 72%, but as low as 62%, I believe, in South Africa. So they averaged it out. That vaccine has an efficacy of around 64, 65%. Clearly, compared to Moderna and Pfizer, it has less efficacy against severe disease, but is just as efficacious against protecting us from dying from COVID-19. And I think that's important to pay attention to. Now, people will ask all the time, Dr. Hancock, well, which one would you get? The one they have is how I respond, right? It's that old school elementary, you get what you get and you don't get upset. If all they have are chocolate cupcakes, but you like vanilla, you're going to go on and rock with this chocolate cupcake because it's going to protect you, as opposed to waiting to see what else is available. The other thing to pay attention to is how well do these vaccines respond to the variants. What I will tell you, and we don't know yet about AstraZeneca, they're getting ready to apply for their emergency utilization authorization. I'll have to come back and we'll talk about that one. Yes. But in terms of the variants, so all of them respond very, very well to the UK variant, B117, right? That's the one that's anticipated to be the most dominant variant here in this country by the summer. So it's phenomenal news that all of the vaccines we currently have available will completely knock that one out. The one we have to worry about is the South African variant. The Johnson & Johnson vaccine against the South African variant goes from an efficacy of around 65% down to 57%, specifically for the South African variant. For both the Moderna and the Pfizer vaccine, still a robust response, but what they have seen is a slight decrease in terms of the amount of antibodies that are generated to the South African variant. We now have 2 variants in California and 1 in New York that we're paying close attention to, because we also know that they're causing more infection. The one in California, one of them is there's concern about it being more deadly. So the more people get vaccinated, the slower we can churn out COVID, which means less people are getting infected. The less a virus replicates, the less it will mutate. The more a virus replicates, the more it will mutate, meaning the more people who get infected, the higher the likelihood it will mutate. And at some point in time, if we do not get ahead of COVID, it will outpace the vaccine. In the same way, if you think about HIV and HIV medications, most of us are very familiar, like a lot of us, particularly people of color, particularly Black folks, have a loved one, a family member who has had to maneuver through HIV medications, right? Like they were on this medication and they slipped up and stopped taking it, and within a week their viral load shoots up because HIV is the most brilliant virus I've ever encountered. COVID is almost as smart in terms of its ability to mutate, but we've still been able to get ahead of the curve. We have to stay ahead of it. Otherwise, the vaccines that we've all rolled up our sleeves to get or considering will not be useful come winter, come spring of next year if we don't get ahead of the curve.
Wow. That's...
And the other good thing is that all of them are really working hard to anticipate what this will look like. It's one of the first times in health where I've seen us be more proactive as a country. I'm like, ooh, finally, we're not reactive, we're proactive. So they're trying to stay ahead of these mutations so that if and when we need a booster, they already know what we need.
Mm-hmm.
Yep.
Frank said,
and I will take that shot. As much as I don't like shots, I will take that shot.
Mm-hmm. Me too.
I don't like shots.
Thank you, Frank.
Yeah, he said, thanks for explaining. Yeah, I think a lot of people are confused. Me being, one Macwa in West Palm Beach says, great education. And I think that's what, every time you come on, we're going to have to do a number 3.
Yeah.
Because I'm looking at the time, I'm like, wait a minute.
And I just have one follow-up question to that, too. I have one follow-up question to that too. Okay. So now, is that something that you're going to have to take every year, similar to the flu vaccine? Are they talking about whether or not we'll have to go back come this time next year and take it? Because I know it started in March. Yeah, I'm also wondering about that too. Will it be like a certain time frame that you will have to take the vaccine? Based on where they feel like the numbers are going to be high, similar to the flu vaccine, and will we have to take it again?
Those are excellent questions. So the easy answer to that question is yes. The more challenging way to answer it is it depends on how quickly we can get ahead of the current COVID-19 pandemic, both nationally and globally, right? You think about this virus, it does not respect country borders. And so luckily I heard you guys shout out Jamaica. They were able, right, to participate in COVAX. But with this previous administration, because we did not participate in COVAX, we could not use our collective capacity to make sure that every single country across the globe had equitable access to this vaccine. And we are a traveling people. So if the various countries in Africa do not have the same access, and I bring them up specifically because they have not had equitable access to the vaccine in the same way they did not have equitable access to HIV medications, history repeating itself. So if you want to go to Ghana, but Ghana has not had equitable access, but we bring our cootie over there, then guess what's going to happen? The beautiful thing about the continent is that their public health infrastructure is bar none. They can handle their business. So I'm not as concerned about them being able to control the spread, but it's not right that they don't have equitable access. So it is us having equitable access across the globe that will slow down the numbers. If you guys start seeing, as you guys alluded to earlier, the more comfortable people become, more complacent they become, our numbers have started to creep up compared to just last week. And so if we don't get ahead of the curve and slow our numbers down, we will not only need to get a booster shot next year, we may actually have to get a booster shot come fall or winter if these variants go bananas in the way that some epidemiologists are anticipating that we will. if we get us some act right and get the vaccine, and if you decide not to get the
You said
vaccine, instead you mask up. Yeah, I said get some act right. Mask up
Get some act right.
instead, get your vitamins, do your, your tight COVID circle, get tested when you're exposed. If we can do all those basic public health measures and or get vaccinated, it will allow us some protection this year to catch our breath. But I can almost guarantee you, I'm willing to bet an entire year's worth of salary, which ain't that much, so don't get excited, that we will have to have an annual vaccine in the same way that we do for flu, because there's still going to be enough mutation globally that's going to still put us at risk, if not for a pandemic, at least epidemic exposures.
exactly.
Kelly says, yes, please get some act right.
Right, Kel?
And Virginia says, thanks, I needed this. Now,
Yeah,
I know,
Lucille
Nikki, I know you were
laughing at that
talking,
too.
Nikki. Go ahead, Nikki.
No, I was just saying Lucille was laughing at it. I love it. Get that. She said,
Get some act right. That's going to be our new thing. You need to get some act right. Now, speaking of this, I'm going to ask a personal question, because we're traveling next week. And my husband, we were waiting and seeing, he's in medical field, and so he had not gotten the vaccine yet, but he did put himself on the list, so and he was not going for it.
No, he was not.
He was not going for it. Now, I wanted to talk about blood types, and if you Google blood type and all this, this comes up: type O and Rh negative blood type, protective against COVID-19. The O blood group had the lowest probability of SARS-CoV-2 infection, while B, the blood group, had the highest probability. What do you know about that?
Absolutely. So there were two major studies where they did what's called retrospective analysis. They looked at a variety of factors to determine what was associated with an increased risk of COVID-19 infection, severity, and death, and what seemed to be protective factors. And over again, that O blood group came rising up to the top. I said it's the gift you get for being a universal donor, right?
Well, I am I'm a Rh negative. So what you think about, Doctor?
So you already know where she's going with this, Dr. Yola. You know where she's going.
But what you still need to do is get your vaccine. Stop playing.
I know. You should stop playing yourself.
Because there was less risk, but not zero risk, right?
Okay.
There was more people with B positive had it negative. That does not necessarily mean that you are immune to getting COVID-19. One of the things that is theorized is that one of the body is by how it connects to the red blood cells. And with there being these blood type groups, there are different ways in which COVID-19 interacts with these different blood types, such that the O negative blood type seems to serve as some protection in terms of COVID-19 infection. So while the good news is that while you get your travel on, you can travel with a little bit of protection, but when you come back, get you some act right.
Okay. All right. I gotta get me some act right.
I love it.
Now,
Jack, you need to make a T-shirt.
I got it. Yes, I gotta get me some act right.
Yeah, get me some act right.
Oh my goodness! Now, Dr. Julius, I saw that gadget that you pulled out. It's funny. I had somebody in my family that got COVID, and one of my doctor friends told her to get it on Amazon. So when it came, she was like, "What is this?" So I'm glad you pulled it out, because we don't necessarily have a doctor in our pocket. Thank God I have all these wonderful doctors around me to get, and we have these platforms, but we don't normally have that in our medicine cabinet. So I think you could order that on Amazon, can't you?
You can order anything on Amazon.
Anything.
So Sherry, wait a second. She put a link in it. I can't see what that was. Can't see the link. But can you tell us the name of that machine? And I know it's for your lungs.
I want to call it a spirometer, if I remember it correctly.
It's called an incentive spirometer. Incentive spirometer.
Right.
All right. And so, guys, we want to give some tips for people who maybe are going through it now. There might be a viewer that passes by the show and they're going through it now. They need something to help exercise their body, or I like that you said you kept moving, and I think the moving is the fight, and so that's when you're wanting to make sure your lung is exercised because you're in the fight. And I think that's I think people don't necessarily know at home how to fight.
You're absolutely correct.
Go ahead.
So with regards to the recovery process, like anything else, there's a time and a place. Moving is necessary once you know you are clear for takeoff. You don't want to overexert yourself when you are still actively positive with COVID. You want to not lay on your back, obviously. Well, not obviously, I take that back. You don't want to lay on your back because it's the worst position for your lungs to recover. What I had to do in the hospital, in my hospital bed, was called proning. And I wasn't exposed to proning, even working in the ICU, wasn't exposed to proning until I became a patient, because it wasn't as prevalent or necessary for the diagnosis that I was dealing with as a therapist working in the ICU. When it comes to that recovery process, if you push yourself too hard, if you overexert yourself, your oxygen saturation will drop. And if it drops too far, you run the risk of becoming oxygen in your blood. And low oxygen anywhere can start a necrotizing or necrosis process, which means there's no oxygen going to your brain or no oxygen going to your heart or anything of that nature, and you run the risk of being hospitalized even further. So if for any reason any of our viewers here are having themselves having symptoms, or they know a family member that's going through it, they need to know first where in that spectrum that they are, just to get the best recommendation. And I'm not a physician by any means. I'm not an ICU doctor or cardiologist, but some basic things will help people to protect themselves. So the pulse oximeter, which goes on your finger, will let you know if it's safe for you to do physical activity. And a safe range is 95% to 100%. 100% obviously is the best, right? But when it comes to it's kind of hard to get past 93%. And that was a problem that I was having, whereas I was ranging between 85 to 93%. And at certain points, which was just simply rolling over in bed, I dropped down into the 70s. So anytime that happens, it scares the nurses. They all come barging in and checking on you if you're okay. At certain points, I was not. But when it comes to knowing when it's safe, you want to first get your negative test, but at the same time, if you can, go on any of your apps like Walmart or Amazon or Target or anything like that, and see if you can get a pulse oximeter to measure it. Anytime you get up, anytime you go up and down the stairs, have it on just to monitor, to see what's going on and see how you feel. And then if you can consistently keep it up above 5, then you continue to need to make sure that you're paying attention to your body. And like those symptoms that I was talking about, the pressure in the chest, the shortness of breath, the taste of blood in the back of your throat, all of those are natural signs that you would be able to pay attention to the gadgets and whatnot. So Dr. getting Julius, that is a good idea, but you want to make sure that you get it in the right time.
Please explain what proning is, because you did mention proning, and people who are watching may not know what proning is.
My apologies. So proning is a position. Laying supine is laying on your back. That's a bad thing to do when you have any lung conditions, period. Proning is laying on your stomach. It gives your lungs the most optimal opportunity to recover with the least amount of work. When it comes to having COVID, my personal experience was having bilateral pneumonia, and it rests in the lower part of your lungs first, but the more it builds up, so your lungs go from your diaphragm all the way up to your clavicle, right? And when it's building up, it becomes hard to the stomach, allows those in the best position, for lack of a better word, to expel any type of phlegm or fluid, in combination with what did they have me on? A diuretic like a Lasix. It allowed me to purge myself to get the fluid out of my system, and they kept reminding me, lay on your side or your stomach, not your back, sit up, and cough as much as you get the mucus and all of those fluids out of your system as much as possible. They even restricted my water. So my little water jug you see me with, I hold that thing dear to my heart because I was dying of thirst. So I was there, but I understood why they were doing it. They didn't want me to choke
okay.
it, and that's all that pneumonia back up.
Wow.
Yes.
Thank you for sharing that.
Thank you. Thank you for that.
All right, family. I mean, Doc, you're breaking up a bit, Dr. Julius. Can you hear us? Yeah. Thank you so much.
Yeah, I'm here.
Yeah. Okay. Thank you so much, Dr. Yola. We have. I know we are out of time, family. But you mentioned that the numbers went up, and with more people getting vaccinated. You know, I was hoping that, I know last week, or was it the week before, I was watching with my mug. I had my tea too. I was watching, and you were saying that numbers had went down a little bit.
Yep.
And so now,
So what we were seeing, what we were celebrating were these percent declines in terms of the numbers, right? We were looking at 40% decline, and then it was a 20% decrease, and then it slowed down to like a 14% decrease. And then the sun came out, it warmed up, Texas opened up and took away their mask mandate. Mississippi's right behind them trying to do their thing as well. And people are tired. You guys mentioned it. People are tired of being at home. They're tired of being cooped up and not with their loved ones. They want to get it's the first day of spring. It's now May. It's boo up season. Like, there are all of these reasons why people are now out. It's boo season. The first day of spring, didn't y'all know? I'm taken, but I heard what I had heard was blue season. Right. And so for all of those reasons, and I mean, people, when they see the numbers, right, you start talking about 40% decrease, then that means COVID is no longer as much of a threat. We're doing a much better job clinically of managing patients. So you're seeing people, less deaths occurring. You're seeing less people in the hospital. So all signs point to go outside and live your best life. The problem, the minute we let our guard down, we go out without our masks. Even 20% of healthcare professionals have said they don't know if they're going to get the vaccine. You've got 46% of Republican men saying they're never going to get the vaccine. So you've got a decent amount of people who, based on either the political leadership telling them you don't have anything else to worry about, or this notion that because we're improving in our numbers, I don't have to do all the things I did this time last year. Now I can relax a little bit, or sometimes a lot of it, and go out and do my thing. The other thing we have to keep in mind is the vaccine does not necessarily prevent you from getting COVID. What we know is it decreases the risk of severity and decreases the risk of death. We've now seen a couple of news reports where folks have gotten the vaccine and then tested positive several weeks after getting their second vaccine. And it's like, oh, well, now see, the vaccine doesn't work. No, the vaccine does what it's supposed to do. The person was asymptomatic but tested positive because once she was exposed, she did not have sufficient antibody for the virus to be able to be blocked to prevent the actual infection from happening, even though this particular person didn't have any symptoms. So we still have to move about the building very, very safely until we reach herd immunity, which is about 70 to 80% of the adult population, plus speckling of some of the pediatric population. We are on our way. We are at the fourth quarter with like 5 minutes to go. People just have to, and I pledged a sorority. I'm in Delta Sigma Theta Sorority Incorporated. You have to suck it up. Go the distance. Finish it out. That's what we have to remind ourselves to do. But in the meantime, in between time, there are things that we can do. Optimize your health. You guys were asking about what are some of the tools to have in your arsenal if and when you become COVID-19 positive. The incentive spirometer is one. The pulse oximeter is the second. I think every Black person on the planet should have a sphygmometer, also known as a blood pressure cuff. There have been people who had no history of hypertension, but because of even mild COVID-19 are now hypertensive on medications. We need to know all of our numbers as we navigate through this space.
Wow. That is a good tip. We need to know all of our numbers. Wow.
All of them.
Yep. Yep, all of them. Your vitamin D level, a couple of supplements that have been shown in data to serve well, vitamin D and zinc. I strongly believe that zinc is the reason why some people are losing their taste and smell. Zinc is related physiologically to your sense of taste and smell. Without zinc, you actually develop something called anosmia, or an inability to taste or to smell. And when you lose the ability to smell, you also simultaneously lose the ability to taste. They're both linked together. And my sneaking suspicion clinically is that zinc plays a critical role. We have not focused enough attention on the nutritional components. And I think for a lot of these people who are experiencing long haul symptoms, if we really focused on nutrition, that might be the way that we transition them out.
Wow. Wow. Oh my goodness. Yes. Dr. Yola, I'm telling you, we can go a whole nother hour. But ladies, do you have any more questions? I know that I want to be respectful of our time. I want people to be able to contact you, Dr. Yola. Please give all your information. Macwa says, amen. Frank says, see Candice, take zinc and vitamin D. So
I got you, Frank.
Exactly. So, please let everybody know. I'm telling you, you have your weekly updates. I mean, you're so informative. Every time you come in, I'm like, wow. Okay, we're gonna have this. Is gonna have to be everybody's asking, like, oh, you're gonna have the doctor back on. You're gonna have Dr. Yola back on. You're a household name at Amplify. So please tell everybody where they can find you, and just give us all the info.
All the deets.
All the deets. Give it all the deets.
So you can find me on social media at Ask Dr. Yola, AskDrYola. My website is easy. It's AskDrYola.com. And you can find me on Facebook at either Ask Dr. Yola or Dr. Yolandra Hancock.
That's awesome. I love it. And I put up. You have so many amazing things going on in your practice. I definitely have to. Okay, let me put this up. Yeah, you guys have to go to her website, check her out, contact her, DM her. Look, I don't want to. We're gonna have everybody blowing you up asking questions. But ladies,
it's so good. I love it.
Do you have any last questions for Dr. Yola before we get out of here? We have Dr. Julius. Yes, please. Dr. Julius, I know you're getting prepared. Let everybody know where they can find you. Oh,
he's telling the boys to be.
He's telling the boys to be quiet. We can't hear you.
We can't hear you, Dr. Julius.
Dr. Julius, we can't hear you. Okay.
Can't hear you.
My mistake. Can y'all hear me now?
Yes.
All right. So if anyone's looking for me, y'all can find me on Instagram at rehab_DC on Instagram and Facebook. That's my professional page, and Marquise Julius is my name. Call me Dr. J _ between each one with the K for the noobs.
Awesome. Well, thank you so much.
All right, Crimson and Cream.
All right.
That's the fraternity sorority thing. Thank you so much for coming on the show. We enjoyed you guys. It looks like everybody has. Okay, everybody's back on. Okay, we all froze up a little bit. Dr. Yola, we see. Thank you so much for coming on, ladies. You guys are still in the. Yes. Yeah. Let's see, you guys are still good. Yeah, everybody froze up. Okay. So family, thank you so much for being on with us. We have been informed once again.
I know.
I am so Candice, are you closer to making your decision? Oh, Candice is gone?
Candice is frozen too.
She's frozen too. Well, family, we're way over time. Thank you for showing up. Dr. Julius, I see you. He's traveling. Okay, Dr. Yola's back. Okay, good. Everybody, Candice is back. Yes. All right, family. Yay. Thank you for coming on.
Thank you, guys.
Awesome job. Thank you so much. And catch Dr. Yola on Wednesday on her Facebook Live. We will. When I see it, I'm going to make sure that I share it because you keep us informed. So thank you so much. Candice, are you closer to your decision?
Candice, I don't know if you heard Jackie's question.
Yes, are you closer to your decision? Everybody's freezing.
Candice, are you closer to your decision?
Yeah, I was actually
yes.
I was actually looking at the registration site for our county, and I was filling it out.
In Jersey. Oh!
Yeah.
Well, I know some of you guys are still on the fence about it. Y'all pray for me.
Well, we pray for you all the time, Boo Boo. So
thank you. Turn to signed up. I'm gonna go on.
You're gonna be the last one on the totem pole, but that's okay.
But listen, you guys are going to get me prepped. Maybe we can do a whole show on getting me a week of getting prepared. And Dr. Yola coaching me and Dr. Julius giving me all the remedies and hydrating and taking all the stuff I'm taking extra. You know what? That's a good thing. Dr. Yola, we're going to have to talk because I'm going to need to know what milligrams of zinc, vitamin D, and all those things that I need to do to get myself prepared. Candice, you ready?
I got you.
Yeah.
Candice, yeah.
I'm ready.
Frank, yeah.
Frank said, yeah.
Are you ready, Frank?
Don't sound too moto about that one.
Well, you know what? Dr. Julius, you saying that you took the vaccine after going through what you went through was pretty inspiring, to know that it didn't harm you. And so, I think that's what we're all concerned about. All right, family. Love you guys.
All right. Bye, everyone.
Love you.
Take care. Thank you.
Bye. Thank you.
Hey.
They were.